name is Dr. Boris Borisjani, B-O-R-I-S. Last name is B-O-R-A-Z-J-A-N-I.
Dr. Evan Valle, E-V-A-N-V as in Victor, A-L-L-E.
My name is Dr. D.W. Donovan. I'm a chaplain and the Chief Mission Integration Officer. It's two initials, D and then W. Last name is Donovan, D-O-N-O-V-A-N.
So yesterday morning we received a report that we were going to have two trauma victims coming from the shooting. One arrived by helicopter due to traffic, another one by ambulance. Both were initially evaluated, were in stable condition. The one trauma victim that I took care of, I will comment on, and Dr. Valle will comment on the second trauma victim. So the trauma victim I took care of is the 15-year-old girl who suffered a single gunshot wound to below the belly button. This bullet had traveled to the left hip and was lodged in the hip. She was, her blood pressure was stable. We were fortunate enough to be able to get additional imaging. There was some concerns for vascular injury. We were able to go to the interventional radiology suite and rule out that injury. There was also concern for intra-abdominal injuries, so she was taken to the operating room and had a minimally invasive procedure as well as a sigmoidoscopy to rule out any sort of injury. Her wound was cleaned out and we were able to retrieve the bullet that was lodged in the left hip. She's currently recovering and hopefully should be discharged in the next day or two. And Dr. Valle will comment on the next victim.
The second patient we received was a 14-year-old girl who also received gunshot wounds, one to the left shoulder, one to the lower right abdomen. She was stable when she came in. She wasn't having any abdominal pain. Vital signs were reassuring. Further imaging just showed soft tissue injuries, fortunately no fractures near the shoulder. She was doing well and admitted for observation and to assure that the trajectory of the bullet wasn't close enough to the abdomen to cause any further injury. She's been doing well and recovering. She's being treated for the wounds, and we expect her to make a full recovery and hopefully home in a day or two as well.
We can open up the questions. I'm sorry? One suffered a single gunshot with a retained missile, meaning one wound. We were able to retrieve the bullet. Dr. Fire took care of the second victim, and she was shot twice. The bullets had gone through and through if you were to connect the dots. Any other questions? Excuse me. Correct. Our trauma bay is set up where we're actually able to take care of two trauma victims simultaneously. We're very fortunate actually to have two trauma surgeons in the hospital. Our trauma director was also on standby roaming around the hospital for additional help. So during the care of both care of patients, they were in the same room, and once we were done with the workup, they were both sitting up, smiling and talking.
Both of you deal with these types of injuries, I gather, on a regular basis. I'm just wondering, do you have scales where people are in life-threatening situations and not trying to downplay what they were facing? But when they come in here, were they in a condition that you felt they would be able to be saved and recover and move on?
So both trauma victims did have signs of life, stable vital signs, but anytime you have any sort of injury to the intra-abdominal cavity or any sort of cavity that we can't provide direct pressure on, we're concerned that there's active bleeding. So at that point, during our trauma system, we activate based on pattern of injury, vital signs, and we make decisions upon arrival with the personnel that are involved in the care of the critically ill. So fortunate enough, we have a gamut of people that are involved. We have respiratory therapists, we have a spiritual care team, we have a security officers that help, trauma surgeons, ED docs, nurses, as well as technicians.
So again, only one patient had to undergo surgery? this, or the expectation is that they both will be released in the next couple of days?
Yes, the victim that did require surgery, that was to rule out any additional injuries. I would suspect that she'll be discharged in the next day or two. And Dr. Vai, as far as your patient?
Yes, the patient I took care of, she just had what appears to be superficial injuries. She was monitored closely to see if that was in fact any deeper. And she's been doing well, so I expect her to start getting up and out of bed and hopefully out of the hospital
How
soon.
would you describe their strength, their spirit, doctors always tell me that the emotional aspects of something like this are very important for patients to recover.
I think both girls were very stoic. They were composed. They were talking to us, and I think they were handling it exceptionally well.
So you said superficial injuries? In terms of the
For the patient I took care of, yes, from all we can tell from the imaging, the trajectory of the missile appears to have gone in a pattern outside of the abdomen, so just in the soft tissue planes.
So for us, superficial injury means that it's not a deep enough injury that's going to warrant an immediate operation where we're worried about life-threatening bleeding.
But it could have still gone through the body.
It did go through the body, but through a compartment that didn't warrant an operation, just admission, observation. The one thing that you pointed out as far as psychological effects, we work very closely with that spiritual care, and I'll have Dr. Donovan talk to you guys about this. We have a spiritual care team involved. We also have a clinical psychologist in the hospital who's going to be involved in the care of both patients with the permission of their families. Both families have asked very thoughtful questions about the right time to inform their daughters on what happened and what the outcome and the aftermath of the victims in the accident. So, Dr. Donovan, you want to make a comment?
I appreciate the question, and I want to underscore and share with you that the family has asked us to share with the public through you how very much they appreciate the outpouring of prayers and thoughts and gestures of kindness that have been sent to them through various forms of communication. It is tremendously important that we think about whole person care, and so we do have a very strong team of chaplains. One chaplain was with each family for the duration of the time through yesterday and picking up again today. Somebody was with them through the night as well. Those chaplains are trained in a very special way to help bridge the gap between ministry and medicine and be able to help guide people along a very, very difficult situation in the crisis. They are well integrated, as Dr. Borgiani mentioned, with our trauma teams and work with them very closely and so understand kind of the dynamics of that. As was mentioned, the family has been asking very thoughtful questions about how do we talk to our kids about this. That's a great question, and we've had those conversations with them. It's one that's important for the community as well. For those who are not directly impacted, we're not here in terms of a medical need, but certainly have experienced a trauma. And we recognize that kids of this age, their first conversation may not be with their parents. Their network of support is through their kids and through their friends and through their phones. But we urge folks to stay connected with their student children and be aware of those signs. And if you have any doubt, to do reach out for professional help. That's certainly something we can help guide you from here as well if you need help with local resources. Yeah, the question was, is this particularly difficult for our staff? And I would say it is. And at the same time, our teams train on this and are prepared for this. And so we work on this on a fairly regular basis to be prepared to deal with a mass shooting, earthquake, fire, various things that are going to take a lot of resources and a lot of people working closely together. We also recognize that a few days from now, they will need care as well. And so we have processes in place to go back to our caregivers and to make sure that we're nourishing and caring for them as well in the aftermath of such an event.
When they first arrived, did they say anything? Did they have any idea what happened?
I'm going to say yes, and I want to tie it into an image that was powerful for me. When the first helicopter landed and the mother was with the patient, she was immediately joined on the helipad by one of our chaplains. The three of them, the patient, the mother, and the chaplain, were immediately in conversation, not only dealing with the medical evaluation and issues as they were wheeling over, but immediately starting to process the events and helping the person and the patient and everyone involved to process through and help manage their emotions as a part of this. I don't know the answer to that. Mm-hmm. Absolutely. I'll start by saying I'm not a specialist or a counselor, but in terms of the training of the chaplains, we recognize that there are certain communal covenants. One of those, it's an implicit understanding that our kids will be safe at school. And when one of those covenants, one of those kind of implicit beliefs is broken, it violates our sense of safety for the world. And so there needs to be intentional work to recognize that while this is not an isolated incident, sadly, it is not a daily incident either. And to start to work with the person, not immediately, because they have enough things going on in the immediate, but over time to integrate this experience into their life. I would suggest that there are triggers that can happen. And so, for example, somebody who might have been in the Las Vegas shooting or affiliated with it, an event like this can start a new process of grieving that requires support and possibly professional help. Yes. I believe it does. The social media is how many of kids today communicate with their friends. They might have a fairly in-depth conversation over text messages, but that is their go-to method of communication. There's no reason to change that and try to substitute something else. Yeah, I'm going to turn that over. You want to take that? Thank you.
So we're very fortunate to have an organized trauma system here in the United States, more importantly in LA County. So during any sort of emergency response, that is responded to a radio room where a trained nurse takes the information, based on that decides if a patient meets a trauma criteria for activation to the closest trauma center. And then based on vital signs, mechanism of injury, and concerns for life-threatening injury, the scale of the activation can be escalated, which really makes a difference for us. It helps us because we do get some lead time. We're fortunate enough to have lead time with both victims. Both myself and Dr. Valle actually greeted the patient on the helipad along with the rest of the treatment team as far as transport. Those few extra minutes gives us a lot of information, because we're not going to be able to do any interventions on the helicopter pad. However, we're able to start working on the victims.
So did both girls then tell you that they had been shot?
Correct.
Did these two girls know each other or know any of the other victims?
So the question is, do both the girls know each other? Yes, they do. Because once we were done with the initial treatment, initial evaluation, and both patients were felt to be stable, both were sitting up with their families in the room, they were conversating with each other.
And did they know the shooter or any of the other victims?
We weren't given any information on that, and we really were focused on taking care of them. You had a question? No, only one trauma victim was flown in, the 15-year-old that required the procedure, that required the operation. She was flown in. The other victim was brought in by ambulance.
Have they been updated on the other victims, or do they know anything about?
That's a great question. Have they been updated? We have not commented to them about what's been going on with the other victims involved in the shooting. Families were very thoughtful. They asked immediately when is a good time to tell them, and that's when we rely with our spiritual team and also with our clinical psychologist. To be honest with you, in my opinion, it's not a professional opinion, there is no right answer. There is no, as Dr. Donovan pointed out, you have social media, kids do talk. There is a and students, because on a day-to-day basis, you don't know what's going to happen. Correct. Diagnostic workup. Scans are to evaluate that we greet in this hospital, anywhere between 5 to 25 patients have penetrating injuries.
This is a common occurrence.
I'm sorry?
This is a common occurrence. It's not like it happens once a month. It's a regular.
It is a common occurrence. Unfortunately, in the United States, annually there's 38,000 deaths associated with firearms. There was approximately 83,000 non-fatal accidents from gunshots. So it's just a reality of the world that we live in.
What would you tell parents that have guns in their homes with children this age?
I'm going to have Dr. Donovan answer that question.
I think that's probably beyond the purview of Providence publicly. I certainly would believe that anyone involved with this would urge safe handling and care and caution to make sure that we do everything in our capability to avoid such incidents. But we recognize it is a divided issue, certainly. I do want to ask Dr. Borgiani if he would make one more comment. We do a lot of work in the community to try to prepare for such incidents. And I would ask him if he would just say a brief word about our commitment, not only here at the hospital, but in the community ahead of time.
I'm sorry, and just following up, like you said, it's
Please.
quite an issue. We see the aftermath. So how do you respond to that? Shouldn't you?
I have strong feelings about it on a personal level, but Providence itself has, I'm not aware that there's an official stance on that. It is a tragedy, and we do see it firsthand. And I don't think there's a single person that would argue we certainly need to take some measures. What those measures are beyond my immediate purview.
So in my mind, when we look at what the tragic events that's happened, it's a complex problem. It's a problem of access to firearms, behavioral health, a culture tolerant of aggression, and the reality is it's an unacceptable public health problem. We have done a great job as a country when it comes to systematically reducing trauma deaths. So trauma deaths from motor vehicle accidents over the last 20 years have decreased by 27%. And I would urge lawmakers, health organizations, professional organizations to work together to come up with this complex problem. That problem really involves having research, innovation, technology, and cooperation. And there is many metrics involved, and it's not just as simple of having guns or not having guns. Going back to some of our efforts, for us, the most important part is being prepared for this kind of an incident. There's a lot that goes into this. Local trauma centers are involved in disaster management. We urge all local hospitals to get involved because there are trauma courses available through some of the local universities that allow those systems to practice and drill down for preparedness. Through our efforts, especially here at Holy Cross, we participate in a campaign through the American College of Surgeons called Stop the Bleed. You can look it up on stopthebleed.org. Our focus here is to teach civilians how to address life-threatening hemorrhage, how to recognize it, how to ask for help, and how to temporize things before emergency medical services arrive. I'm proud to say that Providence Holy Cross, to this date, since starting the program in June of last year, has trained over 748 people. These are students, student nurses. We're talking colleges, we're talking churches, we're talking even a nightclub that we worked with as far as educating their staff on learning about stopping hemorrhage. This is, in actual fact, we did have a Stop the Bleed course at one of the local hospitals, local high schools yesterday while this accident was happening. Any other questions?